Good afternoon, everyone, and welcome. Thank you so much for coming on this couple days after a holiday weekend. I hope everybody had a nice and relaxing time, or if you're like me and had a ton of family over, that you're in recovery and it's fine and you're starting your week off. So welcome again to our organizational capacity and readiness for implementation with a research partner webinar. We're so excited to have you here. And if I could just get all of you to put your name, your CCBHC, and just your primary role in the chat for us. We'd like to get that information from you as we get started. So as I said, very long title for you today, but we're excited. The goal of this session is really to help you all understand readiness and capacity to implement your implementation study. And as it relates to really particularly partnering with a research partner. So we've got a great group of presenters again today, following the same format as we did last time, with some of our subject matter experts, and then someone from the field who really does the same work as you and leads a great organization, Egyptian Health, in doing that work for CCBHC. So I think we're really hopeful that you'll enjoy this conversation, that you'll take away from it what is important. And our goal is really to make sure, like I said, that you guys understand organizational readiness, that you've got some good access to measurement tools around how to measure organizational readiness, specifically as it relates to evidence-based practice implementation, that you've got some thoughts leaving this that are enhanced around the considerations that you need to have for working with a research partner as it relates to this study. You've got data that you can identify in your own organization that'll help with this, and that there's some thoughts that you might have or can share with the group about really engaging with community members as you do all of this work. Okay, so let me hand this over. So we have three presenters today. We're using the same format as we did before. So Angela Weeks and Kimberly Arnold are going to be your presenters, and then Elizabeth's going to swoop in and give all the practical from the field experience that she has. So real quick, as a reminder, actually, I don't think you guys have met Kim before. So Dr. Arnold is an assistant professor of family medicine and community health with a secondary appointment at the Department of Psychiatry at the University of Pennsylvania Perelman School of Medicine. She's a mental health services researcher and an implementation scientist who specializes in advancing health equity and reducing physical and mental health disparities experienced by Black Americans. She's an expert in community engaged research, multi-sector collaborations, and social determinants of health, and also engaging stakeholders in the planning, implementation, and evaluation of evidence-based interventions in clinical and community settings. Angela is from Innovations Institute. You met her last month. She is director of our National SOGI Center at Innovations, and she brings extensive national experience creating, implementing, and evaluating programs and initiatives that improve the lives of LGBTQ+ people and communities. She's led several initiatives grounded in implementation science, including a Children's Bureau Quality Improvement Center for LGBTQIA populations in foster care that was focused on working with providers to identify impactful practices and move them along the continuum of evidence. And then Elizabeth Cook, who I just got to meet in the last few weeks, I think is going to add so much to this. She's the Director of Quality Improvement at Egyptian Health in Southeast Illinois, and runs the data collection and so on. And I believe, Elizabeth, you told me that you had some evolution in your job as well. So I'm going to let you introduce yourself a little bit when it gets to you. But the one thing she did tell me is she coaches roller derby. So I feel like out of all the things I just told you, that might be the most important thing about everybody that you just learned. So I'm going to go on mute, hand it over to you fine ladies, and let you take it from here. Thank you. And please, please, please pop things in the chat. If you have questions, we have Q&A at the end. Okay. Thank you.
Thank you so much, Michelle, for that warm introduction, and good afternoon, everyone. We can go to the next slide, please. Our learning objectives for today are to define organizational readiness, explain how to measure organizational readiness to implement evidence-based practices, describe organizational and operational considerations for working with a research partner to implement and study implementation of evidence-based practices, identify ways to use data from implementation efforts to drive organizational change, and to discuss the importance of involving community members in the implementation of evidence-based practices and research design. So we have a full agenda planned for you all today. Next slide, please. So first, we're going to start off by talking about readiness. So what exactly is readiness? So readiness actually has two components. The first is readiness for change. And this is the extent to which an organization is willing and able to pursue efforts directed at improving outcomes. So these outcomes may be service outcomes such as equity, safety, efficiency, effectiveness, or patient-centeredness, or client outcomes such as satisfaction, or even clinical outcomes such as improvement in mental health functioning, or reduced symptoms of depression or anxiety or other mental health conditions. An important question related to readiness for change is your agency prepared to pursue a change effort to improve outcomes regardless of the intervention? When we look at readiness for implementation, it is the extent to which an organization is both willing and able to implement and sustain a selected intervention. Is your agency prepared to put in place a specific program, practice, or other intervention to improve outcomes? An important note is that an agency must be ready for change before being ready for implementation. Next slide, please. The key components of readiness are motivation, general capacity, which is related to organizational capacity, and intervention-specific capacity, which is related to the specific intervention selected to facilitate change. Motivation is the willingness or desire of individuals in an organization to change and adapt an intervention. Motivation is reflected in the beliefs, attitudes, and commitment of leaders of the organization, as well as staff and other stakeholders who may be involved in implementing the selected intervention. General capacity refers to the aspects of an organization's healthy functioning, such as leadership, climate, expectations, and procedures. And we'll talk a little bit more about that in the next slide. And last, intervention-specific capacity refers to the ingredients needed to facilitate successful implementation of a program or practice, including physical, technical, and human conditions within the organization. Specific knowledge, skills, structures, and supports needed to implement the selected intervention should be considered. Next slide, please. Here are more specific examples of factors within each of the categories of motivation, general capacity, and intervention-specific capacity that contribute to readiness. As you can see here, beliefs play a huge role in motivation. In addition to the belief that change is needed and valuable, leadership and staff must also believe that the selected intervention is compatible with the vision and mission of the organization, doable or feasible, as well as important. There must also be recognition that the selected intervention has a relative advantage over what is currently being done in regular practice within the organization, and that outcomes of the intervention will be visible, meaningful, and impactful. General capacity is heavily focused on the organization's ability to create the change that they are seeking. How well equipped is the organization to adapt to change and achieve its goals? There are multiple interrelated factors listed on this slide that contribute to an organization's capacity and readiness to change, including leadership, organizational innovativeness, and receptivity to change, culture, climate, available resources, adaptability, supportive structures, as well as staff capacity to contribute to change efforts. For intervention-specific capacity, this includes things such as stakeholder buy-in and support, including the buy-in and support of all stakeholders involved, such as leadership, staff, agency partners, as well as patients and clients. Program champions who can really champion the specific intervention, and they have a vested interest in making sure that it's going to be successful, as well as intervention-specific knowledge, skills, and abilities. So this may include specific knowledge needed about the content of the intervention that's being delivered, certain skills that are needed for the implementer, as well as their abilities to connect with the patients or clients that they are serving. And sometimes this may include training that has to occur to ensure that that specific intervention can be delivered with fidelity, as well as other implementation supports and structures that may be needed to facilitate successful implementation, as well as relationships and networks, which may be outside of the organization itself. So in our presentation today, we're talking a lot about working with researchers. So some of those relationships may be with researchers at local universities or within professional networks that are affiliated with the particular organization. And next slide, please. And now I will turn it over to Angela to discuss key readiness indicators.
Thank you so much. And I am really excited to be talking about this today. I love talking about readiness and prepping for implementation. And so I'm going to dig in to what was just briefed by Kim and give you some specifics and also give you some resources that can help. So as you're thinking about this today and going through this presentation, keep in mind there's a lot of tools out there that can help you assess some of these readiness indicators. There's a lot of literature out there to help guide you through it, so you don't by any means need to be an expert at any of these things, but just to start thinking about them, right? So here are some key readiness indicators to think through. First, have you identified the right problem you're trying to solve? So that's important because sometimes we have assumptions about what a problem might be. And once you start talking to stakeholders or the people who are receiving the services, you identify that there's actually another problem, a different problem, or a different direction you need to go into. So part of readiness is understanding, do I understand the right problem? And then how do you know, right? And then also, how have I identified the right solution to that problem? So I'll give you a really basic example. Let's say you have a program that you're implementing for families and there's a lack of engagement. People aren't showing up to the program. You think it's because the incentive to engage in the program is not high enough. So you increase the incentive. That might not be the right problem you're trying to solve. It could actually be that families are not able to attend at that time, or they're having transportation challenges, or they may not think that program is appropriate to the problems they're trying to solve in their lives. So it's really important to understand as part of readiness, are you focused on the right things and do you have the right solutions? And then do your policies and protocols support the work you are about to do? So again, in that example, if you need to increase flexibility around when you're providing services or providing transportation to family engaging in services, do you have policies and protocols in place that will support that type of work? The next one is, do you have the right team in place to implement and integrate the message and the work? So part of readiness and what will really help you in your implementation efforts moving forward is that everyone understand the message, understand what you're trying to do, have some clear things to communicate to team members and others that are involved about cohesively, what is this work about and how does everyone have a stake in the work you're implementing? The next one here is, do you have the right financing and resources to support effective implementation? So this is the topic I think you all will get into in future sessions too. We're really thinking through not only implementing the intervention and conducting the research, but also providing coaching and the right types of supervision and fidelity and training for the folks that are implementing the program on the ground. And then also the time needed to scale up a new intervention. So all of these things have their own determinants and sort of factors to think through. And again, there are tools and there's lots of literature you can access to help you think through some of these things. And the last thing on here is, will your climate support the change? So I'll dig into this a little bit, but there's quite a few factors to think through there. So next slide. For those of you who were in the presentation on implementation science frameworks, I presented a handful of frameworks that are often used in this setting, and I wanted to make sure that you had access to tools directly connected to those particular frameworks. So this is just a resource list, and this will also be sent out after the session in a Word document. But the links here are to specific readiness tools for these frameworks. So if you left that session and you were considering a framework or leaning towards one, or if your research partners have a framework that they use, here's just some easy links to get to some of their readiness assessments. Next slide. Okay, so staff readiness to change practice. One of the things that folks don't often think about is psychological safety. And this is something that I think is really important to assess if you're trying to change practice that's been sort of the status quo for a long time, or if you're doing something new and innovative. It's important to understand how psychologically safe does your workforce feel? Because in order to do something new, to step outside the box and do something that you're unfamiliar with, you have to accept a little bit of vulnerability, right? You might make a mistake. You might need more support in training and coaching and supervision. And so do you have an environment where folks can admit when they've made a mistake, where they can seek help if they need support? That psychological safety is really important to how quickly folks might change their practice or develop buy-in to the types of initiatives that you're trying to implement. And there are assessments for this too. So I think thinking through those things, is your organization one that really values innovation? If people identify that there's a better way to do things, are they likely to bring that idea to leadership? Are they supported in those ideas? Those types of things can communicate or demonstrate a certain level of psychological safety. Another one is how many other new initiatives has your organization started but not maintained? If you're an organization that picks up new projects and tries a lot of new things, it's important to understand the impact on the workforce when those initiatives suddenly go away and the reason for them going away are not communicated to staff. Because in essence, what the workforce is asked to do is to try new things, to change their practices. That takes a certain level of commitment and work. And then they're sort of left out of the loop when it comes to de-implementation of programs, or if your organization doesn't communicate data to staff very often about how things are working or not working, it may feel really defeating to have a lot of new initiatives that folks are trying to manage in that way. So one of the things that I say is that if your organization has had a lot of new initiatives that haven't continued, it's important that before you engage in another one, you acknowledge this pattern with staff and you describe what you're going to do differently to maintain their efforts in the long term, but also communicate to them. If something needs to be de-implemented, then how will you communicate that change to staff? And also, if their efforts are resulting in good stuff happening, how are you going to communicate that good stuff to them? How are you going to share that data so they know that their efforts are worthwhile? The next one is, do staff have a shared interest in changing practice? A couple of things to think through are you an organization that typically talks about the value of data? Do you use data in decision making? Are you an organization that values evidence-based programs and practices? Does the workforce know what that means and knows how important that is, right? If not, that's totally fine too. Doesn't mean you have to have that history. It just means that maybe this is a conversation you want to have with the workforce before you get into any heavy implementation lifts. And also, do they believe in what you're doing? And do they think that what you're doing will help their workload? Really important, right? Especially if you have a workforce that is at capacity or over capacity, to think through how are your current efforts going to help their workload in the long run? How is it connected to the mission and the vision and the values that they hold? Will be really helpful in kind of just fast tracking the types of changes and behaviors you'll want to see from folks. Next slide. And I have a couple tools for you here. So one is the psychological safety assessment, and it's just a quick assessment that can give you a starting place on what to look for if you're trying to measure psychological safety in your organization. You can have your teams take it, or you can have your implementation team take it. I will say that it is helpful to have different people at different levels of the organization engage in these readiness assessments. I've worked with many organizations where the leadership team does a readiness assessment, and they have very different answers about readiness compared to when their workforce takes the readiness assessment. So it's helpful to have a variety of people involved in that process. The next tool here is individual staff readiness to change. So this just is something that you would give to folks individually to sort of gauge how willing are they to make changes in their practice. And this, their willingness could depend on lots of things, psychological safety. It could depend on how busy they are and how much work they think the change will require of them. But it is helpful to know so that you can sort of mitigate any issues up front if you anticipate them and try to support your workforce in the best way. Next slide. So this is a little bit of a random slide, but I wanted to add in here the most important factors that affect implementation because you all took a survey a couple of months ago and you ranked the most important topics that you wanted to hear about. And this was one of them. You wanted to know what were the most important factors when implementing evidence-based programs. And so I conducted a systematic review. It was in child welfare settings, but the programs were all either parenting programs or they were mental health programs. So I think the findings will be really helpful to you that were interested in it. We're going to drop that study in the chat for you. Just skip all the stuff, go right to the findings. Everything is listed there really neatly with lots and lots of examples of what is helpful and what is harmful when you're engaging in implementation efforts. And I do think it would be great for you all to skim that, sort of see the headers of what are the things that stand out, because that's going to also help you understand what to prep for and to make sure that you're ready in those domains that are outlined in this paper. And there's lots of literature that's out there on factors regarding implementation science and evidence-based programs, but sometimes it's not as focused to settings like child welfare or behavioral health specifically. So hopefully this resource will be helpful to you. Next slide. I also wanted to give you some guidance on how to assess the readiness of whatever program or initiative you'll be implementing. So the Active Implementation Research Network has this great tool. I use it all the time, and it is to assess if interventions are usable and coachable. And this is helpful, and it's been helpful to me so many times because often I'll pick up a program that has been implemented all over the country or in many settings, or it could even be something that folks are saying is an evidence-based program. And I assess it with these criteria, and sometimes there are really core components missing. And then if they're missing, they usually cause frustration among staff who are trying to implement it. So let me go through this real quick. Programs would be ready to implement if they have clear written descriptions of the program to include values and principles. The program should have clear information on who is eligible to enroll and who is not. The core components of the program are clearly defined, and we know why each one is important. Each core component is defined with good examples so that the people implementing it know what they need to do or say or provide to perform those core components. There's a fidelity tool that captures performance of those core indicators. And then the fidelity tool is something that can be used in a typical service setting. So again, if you're thinking about a particular program or initiative, just making sure that that program has these things in place. And if they don't, you can always sort of figure out with the creator or others, how do you get these in place so that at the point of implementation, your workforce is not frustrated because these core components aren't outlined very well or they're not sure what they should be doing. Next slide. All right, readiness to use data is another big bucket. You want to think through how are you currently using data, set up to use data, collecting data, how do you communicate data in meetings, that sort of thing. How do you have someone who can analyze and brief you on the data on a consistent basis? This is probably your research partners, right? And so just thinking about what's the process for that? How often are they going to communicate data to you? Do you have a climate that values data? And if the answer is no, that's okay. You know, you just want to make sure you have that conversation ahead of time with your workforce and provide them some resources on learning how useful data can be in decision making and planning. Do you already share data with staff and community? If not, that's okay too. You just got to figure out how you might do that as you're getting ready to implement. Do you have the resources to collect, analyze, and brief data on a regular basis? So again, these are really important things to assess alongside your research partners too. They may have strategies in place that have really worked for them in the past, but I did want to give you all some questions to think about. And then the National Implementation Research Network has an implementation stages planning tool that's linked here that actually has a data collection section that's worth checking out if you want to see some of the sort of readiness assessment criteria associated with data. Next slide. So the way you can use data and everyday decision making is really what I like to do is the plan, do, check, act cycles. I think this is the easiest way to explain it. And it's something that folks who are on the ground providing services can really get behind. And once they get used to it, in my experience, they really love it. So you plan something like, let's say, for example, in my previous example, you've realized that families are not attending your program because of transportation issues. So you come up with a plan around meeting their needs around transportation. You do that plan for a while and you see, and you look at your data and you say, are more people coming, right? And if more people aren't coming, you got to redo it, right? You got to decide on a change. What is it that we're missing that we're not getting? How can we improve this process to make sure that they're getting the right transportation to come and engage in these services? If you look at the data and you say, oh, this is actually working, we see an increase in retention, we see an increase in engagement, this is really great, then you just continue what you know to be working in that space. And so the plan, do, check, act cycles are not only about your entire program and how it's working and looking at the data for the entirety of your program, but also looking at the everyday implementation stuff is what we're trying to implement to make access to these services and to make this run more smoothly. Are those little things working, right? These PDCA cycles are really, really helpful in implementation. And again, the folks on the ground, once they understand how you can use data in these everyday decisions, it is helpful in getting buy-in around data and implementation, and also just making sure that people don't have to linger in what's not working. So I think that's it for me for now. So I'm going to pass it back over to Kim.
Thank you, Angela. We can go to the next slide, please. So it's important to note that various stakeholders are involved in EBP implementation. So that includes all of these different categories that are listed here on this slide. So the patients and the public, which are typically the people you are serving through the EBP. So that may include clients, caregivers, families, and community members. Providers, which you all are the providers. So that includes the individuals within the agencies, as well as leadership. Purchasers, which are those responsible for underwriting or sponsoring the healthcare costs. Payers, such as insurers. Policymakers, which are those associated with governmental and non-governmental agencies. Product makers, such as drug and device manufacturers and intervention developers, as well as principal investigators, which are researchers and their funders. So depending on which EBP you're implementing, you may have stakeholders from all of these categories or some type of combination of these categories. And now I'm going to talk a little bit about working with a research partner to implement and evaluate EBPs. So we can go to the next slide, please. Next slide. So there are many different ways that researchers can improve your organization's intervention-specific capacity and readiness for implementation. First, researchers can help educate leadership about the effectiveness of the EBP to increase leadership buy-in and support which is really important to have for EBP implementation. So for example, researchers can gather evidence from previous studies that have been conducted and published and present lessons learned from their previous experiences implementing the selected intervention or similar EBPs. Researchers can also serve as a program champion who can advocate for and support the selected intervention. Some researchers can provide training, coaching, and/or consultation for staff who may be involved in implementation to increase their intervention-specific knowledge, skills, and abilities. They can also identify implementation strategies and supports that are needed to facilitate successful implementation. And I'll talk more about implementation strategies later in this presentation. Researchers can also facilitate relationships and networks with relevant agencies and partners that can help your organization prepare for implementation, including peers that successfully use or have used similar interventions and can serve as positive models of achievable change. Next slide, please. Researchers can also help assess readiness. So it's important to keep in mind that readiness is a dynamic and ongoing activity. Researchers can help organizations monitor readiness throughout all phases of implementation, which are pictured here on the slide. And these are exploration, preparation, active implementation, and sustainment. In the exploration phase, researchers can help evaluate the organization's and/or patients' needs and priorities, the organization's motivation to change, as well as find a potential EBP that will fit the identified needs and priorities, as well as the organization's capacity to implement the EBP. After the decision to adopt the EBP is made, researchers can help assess the organization's readiness and work with the organization to prepare for implementation, which may include helping with training or coaching. And during the active implementation phase, researchers may help assess implementation outcomes, such as fidelity, acceptability, cost, and other outcomes. After the intervention is actually implemented and it's being implemented with fidelity, researchers can help determine the organization's readiness to sustain the EBP. So this may include assisting with various types of evaluation, and this may include things such as interviews with staff who help to implement the intervention, as well as patients or clients who receive the intervention, as well as determining if any adaptations or any strategies need to change for future implementation. Next slide, please. So researchers can also help assess the factors that contribute to readiness. So we've already talked a lot about this, so I won't take up too much time on this particular slide, but researchers can assist with things like measuring staff's motivation, staff's acceptability of the intervention, the organization's capacity to implement the intervention, including the training needs that may be present, as well as identifying existing data sources within the organization that may already measure factors relevant to readiness, such as organizational health or climate. Next slide, please. Researchers can also help develop a readiness assessment approach, so they can either lead or help make decisions about the research design, the various methods to assess readiness, which may include some combination of observations, focus groups, interviews, and surveys. Select specific tools for data collection, such as existing scales, some of them that Angela mentioned earlier, as well as creating interview or focus group guides. They can also help determine the scope of data collection. So when it comes to collecting data, you can collect a ton of data. So it kind of just depends on how much is needed for your particular effort. So they can help to work with you to determine the scope of data collection. And if you want to take the more comprehensive approach, or to determine what's the minimum amount of data that is needed. And that also is going to be dependent upon the funding that's available, because the more data that you collect, sometimes that can become more expensive. And then it can also assist with sampling and recruitment strategies for the readiness assessment participants. So that may include the leadership, staff, as well as getting feedback from clients or patients on interventions that you all may be thinking about implementing. Next slide, please. Researchers can also help with data analysis and dissemination of findings. So this may include analyzing quantitative, qualitative, or mixed methods data, assisting with the interpretation of findings, as well as making recommendations for ways to improve readiness based on the findings. They can also help to disseminate the findings through brief reports, presentations, and/or manuscripts for academic journals so that other people can also learn from the efforts that you're doing. Next slide, please. So here are some considerations for working with a research partner to assess readiness and implementing an EBP. So the first question is, do you already have researchers working within your organization with whom you could work to assess your organization's readiness and help with EBP implementation? If you don't, do you want to partner with a researcher from a local academic or research institution? Next, how much help do you need with assessing readiness and EBP implementation? So some questions to ask are, will the researcher be responsible for all of the data collection, analysis, and dissemination of findings? Will the researcher help with some or all aspects of assessing readiness? How involved will the researcher be in EBP implementation? So for example, will they implement the EBP or train staff within the organization to implement the EBP? Will they measure outcomes of the EBP and make recommendations for change? And last, if you are working with a research partner outside of your organization, how will you pay them for their services? Is there an existing budget for the research within the organization? Or do you need to access new funding from a grant or other mechanism? So we know that I think earlier the NIH was mentioned as a example of an agency. Sometimes there's also additional funding available through foundations in which their grant writing process and their funding timeline is sometimes quicker than some of the other federal agencies. So that may be another avenue to look for foundations that have a similar mission, and that are able to, have different funding opportunities available where you could apply to conduct evaluation or other types of research studies. And that may be a little bit quicker than some of the larger federal agencies. Next slide, please. So now I'm going to talk a little bit about how you can engage community members within the planning, implementation, and evaluation of EBPs. Next slide, please. So I'm a huge proponent of community engagement. And so it's really important to think through ways that you can engage with members of the community in which your organization is located. And that also includes various patients or clients that you're serving. So some of the principles of community engagement include building on the strengths and resources within the community. So acknowledging that the community already has a lot of assets and that you don't want to always approach situations with what is the problem, what is the need, but also identifying what are some of those strengths and resources within the community that you can build upon. It's also focused on doing research for mutual benefit. So you're taking actions to create change and just making sure that in addition to you benefiting as an organization, you want to make sure that the community can also benefit. It also promotes co-learning and capacity building. So maybe in the work that you're doing, you're able to connect with a local community organization that may be involved in delivering the EBP or providing support for patients or clients who are receiving the EBP. And they will also have the opportunity in working with you to plan or implement the EBP. They can also build their capacity to maybe offer parallel programs or something similar within their organization. And it also acknowledges that the community is a unit of identity. So they may have certain cultural beliefs or or other types of characteristics that are unique to them as a community, and to also just be respectful of the ways that people's identity or their various identities may intersect and show up in different ways. So it's always important to have that adequate representation from the communities that you're serving in these decision-making processes, especially when it comes to selecting new EBPs that are going to impact the community. And then in terms of dissemination, it's always important to involve your partners in disseminating findings and to figure out if there are local community associations where you can go and present findings, such as neighborhood associations, for example, or maybe churches or other respected community organizations, and to ensure that the ways that you're disseminating information can reach the various patients or clients or community members that you're serving through your particular EBP. Next slide, please. So there are various types of community engagement approaches. Community-based participatory research is a very popular community engagement approach that involves community members through all aspects of the research process. So earlier on a few slides before, I mentioned those different phases of implementation. And so the CBPR approach is a partnership approach that equitably involves community members, organizational representatives, and researchers in all of those various aspects of the research process, and in which all partners contribute expertise and share decision-making and ownership. So we would say that that would be at the far end of the spectrum in terms of involving all primary stakeholders within the planning of the EBP, the implementation, as well as the evaluation. But we know that sometimes certain projects may not lend itself to having full participation throughout all of those phases, but this is the gold standard when it comes to community engagement. Next slide, please. Engaging patients, clients, and community members in EBP implementation is beneficial for many reasons. So I've included some of those here on this slide. So of course, it demonstrates respect, number one. It also builds trust between the different stakeholders that are involved. It improves selection of implementation strategies and implementation outcomes. So in working with various patients, clients, and community members, they may have ideas about ways to improve your reach, for example, of the particular EBP, or to help think through strategies that can be used to facilitate the EBP in terms of making it more acceptable to patients that you may need to enroll in a particular intervention. And then it also improves clinical outcomes when it comes to trying to reduce symptoms, for example, of various mental health conditions. And it can also provide different perspectives on implementation efforts and outcomes. So I think Angela had mentioned earlier how sometimes you may get different responses from different people depending on who's administering a certain survey or assessment and who's analyzing it. And so when we think about ways to engage different stakeholders, when we involve different people at the table, we're able to get those different perspectives on how the implementation effort went. So there may be a different perspective among patients receiving the intervention versus staff who are directly involved in implementing the intervention, and then leadership who may not be as involved in the direct implementation may also have a different perspective on the implementation effort and the outcomes associated with it. So it's always important to try to get those different perspectives on the implementation efforts. Next slide, please. And last, I'm going to end with implementation strategies. So implementation strategies are methods or techniques that are used to enhance the adoption, implementation, and sustainability of a program or practice. So there are a ton of implementation strategies published in the literature. So I included a link here to a full list of some of these strategies. So I think there are about 73 that are included in that particular compilation, but there are a ton of different strategies. So I've selected some strategies on this slide and the next slide that are more equity focused and are kind of more focused on including stakeholders. So just to give a few examples, under the use evaluative and iterative strategies component, assessing for readiness and identifying barriers and facilitators is considered to be a strategy, as well as obtaining and using feedback from patients and consumers who may be receiving the intervention. Promoting adaptability is a huge strategy because, again, readiness is something that is an ongoing and dynamic activity. And as you are implementing a particular intervention, there may be things that have to change. So it's important to just remain open and know that certain things may have to be adapted along the way to better fit the organization or to better fit the population that you're serving. Using advisory boards and work groups is a great way to involve various community members because you can establish these advisory boards to kind of assist with the planning, the implementation, as well as evaluating what has been done. And of course, we've already talked about training and coaching and things like that. So those are also considered to be strategies as well. And then next slide, please. And then under this particular slide, I have a few different strategies that can also be selected when you're starting out with your EBP implementation. And when it comes to engaging consumers, involving the patients or clients as well as family members within those working groups or advisory boards can be really helpful. And then also really prepping the consumers to be active participants. So informing them about what the EBP is that you're implementing, talking with them about ways that they can be involved in encouraging other people to participate, or even when it comes to implementers within the organization, prepping them as well to be able to successfully implement the EBP or to be involved in the evaluation. You can also set up certain things. So depending on what the EBP is, if it's more focused on getting clinicians to do something, reminding them can be really helpful. So maybe putting reminders in the electronic medical record. So there's like a pop-up that reminds them to do a certain assessment with the patients, or that reminds them to do a certain procedure can be helpful. And then also just setting up systems to be able to capture the implementation efforts and the things that you're doing so that can help to facilitate the evaluation. And of course, we talked a little bit about funding as well. So you may need to access new funding for the intervention itself or for the evaluation component. And I'll stop there and we can ask questions and go into some of this a little bit later. So at this time, I will turn it back over to Angela to interview our guests.
Thank you so much. All of this was, I really enjoyed your presentation. Super great information and resources. So I'm going to invite Elizabeth Cook to pop on camera. You might already be. Oh, there you are. Okay. And hi, thanks for being with us. And I just want to start off with, can you tell us a little bit about your organization and your role?
So my organization is Egyptian Health Department. We are a rural CCBHC. We are in the southeasternmost 3 counties in Illinois. So we border Kentucky and Indiana. We're way down here. I always tell people we're closer to Memphis than Chicago, because when people say you're from Illinois, what part of Chicago? And we serve Saline, Gallatin, and White counties, and have been doing behavioral health services for 50 years this year and have been a public health department for 70 years this year. So big anniversary for all of us. I am currently the director of quality improvement for the health department. I have a lot of interest in data sharing and in creating reports and things like that. So when our compliance officer retired in 2020, they realized that we didn't actually have anyone in charge of quality improvement. It was just part of several jobs. So I moved over to that. Prior to that, I was the CCBHC program director for the beginning of the implementation. And then prior to that, I was actually with a different SAMHSA grant. So we had PBHCI grant, the primary behavioral healthcare integration. And I was actually hired on to implement an evidence-based practice with wraparound with our system of care grant back 11 years ago. So I've been a little all over the place here.
I mean, that's great though. That sounds like you have like the perfect background for this group and to really be able to like add some rich experience. And so you mentioned your EBP a little bit. Do you recall sort of what it was like to prep for readiness around that? What were some of the things your organization was doing?
So we've done over a dozen EBPs at this point since I started here. Well over a dozen. So with the one that I was hired on to direct or to manage, I wasn't here for the implementation readiness portion. They just wrote it into the grant and hired me and said, here's this program, do it. And it was kind of a hot mess because we had been doing parts of it, but we'd not been following a fidelity tool because we didn't have one. So that didn't work great. But one of the EBPs that we implemented as part of our CCBHC was assertive community treatment. And we had previously had ACT as a program here many years ago, but the model for that changed and became something that was not financially sustainable for us, but we still have some staff that had been part of that previous EBP. So going back to that made sense for us, and it made sense for our clients, and it made sense for the services that we needed to do for that, for the more advanced care coordination for our higher needs clients.
Okay, and so since the first EBP that you were part of, has your organization done things a little differently, or maybe you have done things differently to prepare for implementation?
Yes, we've definitely learned some lessons. Throughout the time that we've been doing EBPs, we've had some that have worked really well. We've had some that have not worked well. We've had some that worked really well, but then became expensive, so we dropped them. So in prepping to implement this time, we really talked to a lot of our staff and said, you've done this program before. What did you like? What did you not like? And then we connected with our evaluation team, and they connected us with their researchers because one of their researchers that they're friends with, she's done some contract work with them before, but Maria Monroe DeVita was the person who authored or co-authored the fidelity tool that we were going to be using for our rural ACT program. So they connected us with her and had us meet with her to assess our readiness before we implemented our ACT program.
Yeah, that's helpful in knowing how your evaluators too were part of that process. Mm-hmm. To what extent do you usually involve like community members in preparing for some of these EBPs?
So in our less successful ones, we've had very little community member involvement. We've had, because of the SAMHSA grants that we've always had an advisory board. We call it the governing council here. I'm not sure why, but we've always had the advisory board that was 51% or more service recipients. And in the past, we've had a lot of, they're here because they're required to be here. Here is a nice lunch and a copy of the report that we're giving out to everyone else. Check that off the list. But we really wanted to, especially after our PBHCI, we really wanted to get more involvement from our clients. And so we made sure that that we really gave them more data with the ACT implementation. And then unfortunately, our grant was, we got the notice in April of 2020 that we were receiving the CCBHC grant, and then we all went home in June. So because COVID got here a little later than it did everywhere else, but during that time, we'd had just enough time to start the implementation of our ACT program. And so even though a lot of our clients reduced their contact with us, our ACT program increased their contact with us. So we increased to a mandatory contact with every single ACT client every single weekday. And so a lot of our ACT clients had better health outcomes than our general population clients. So with that information, we presented to them at one of our governing council meetings after we had returned, and they were like, wait, why, how is it that our group that is traditionally the least healthy here had better health outcomes than a lot of your non-ACT clients? And so we actually did a research project that was steered by the peers receiving services. So they designed a study or designed a survey, implemented that to their peers receiving services, and found that a lot of what made the difference was that sense of connection and having social connection, because we did a lot of like virtual concerts that we all attended as a group over Zoom that one of our peer providers found. And so we did a lot of things to try to keep them connected throughout that process. And we've that particular committee is becoming our consumer advisory board. They're morphing after their study. They were able to present at National Council Conference last month, earlier this month. We're not into June yet. So that particular group is becoming our consumer advisory, and they've already started making changes to our survey that we send out to all of our clients after they have been enrolled in services. They had some questions about what are you really trying to find out from this survey, and what am I supposed to be answering on this survey? So they made some changes to that survey even.
Those are such great examples. You're taking the stuff from the slides, and these are just like the real world examples, especially what Kim was talking about in community engagement at the end. So what advice would you give to the folks that are on today who are planning to implement a new EBP?
Two different things. One, make sure that you've got the buy-in from your staff, because having staff that are motivated to do the EBP makes all the difference. If they just think of it as this is another thing that we're going to do for a month and then we're going to lose the funding, or that we're going to do for 2 years, and then when we no longer have to do the NOMS, we no longer have to do this EBP, then it's going to fail. So you've got to have staff that really believe in the project. And then as far as staff goes, make sure that you've got the right people in the right place. When we started our EBP implementation for ACT, the program director was like, I'm here to sign forms and collect a paycheck. I am not here to really do the hard work. And luckily, shortly after we got that grant, he moved on to a different position, and we were able to move one of our RN case managers to the director of that program. She had the appropriate licensure to be able to be part of the ACT team. So that filled one of the positions there that we were struggling to find. We were struggling to find a medical provider that would be part of our team and that would attend the meetings, but we were able to bring in someone that added to her licensure, so that she is now behavioral health certified family nurse practitioner. So she is part of our team now. And we also, we really looked at some of our team makeup and looked at existing clients to hire someone in as a peer provider. So one of our participants who had been, we have a supported employment program, another EBP. She'd been one of our EBP or our IPS clients. She had found a job, but it was over an hour drive to work. And she was a client because of a traumatic brain injury related to a car accident. So that drive was taking a lot of her emotional energy. So we really looked into what we could use her for as a peer, because she is a natural leader within the groups. So she is now leading a lot of the wellness groups and a lot of the activities, and she has a lot of input on program design and caseload management and things like that, that we make sure that we always include her and the other peer providers into our conversations about that.
Yeah.
Have the right people and get all of your staff to buy in.
Yeah, those are great tips. And the have the right people is so important. And I'll just, add to that to say, if you're working with an EBP, hopefully it has an established fidelity tool that outlines the core components of the model. And so take a look at those core components and make sure that when you're staffing your team, that you're considering what are those core elements of the model that you need those skills and lived experience for. It's so important. So thank you so much, Elizabeth. And I'm just, let me check in with our group here. I don't know if I see any questions in the chat, but does anyone else?
We just have a couple, Angela, we just have a couple questions and a couple minutes. So let me do rapid fire with the group that presented today. So this was mentioned, but I just want to circle back to it. Okay. This is I'm like been tagged. Okay. So this was mentioned and there was a private question about it. So just remind the group, given that we're talking about readiness and workforce, what are some of your suggestions about collecting readiness information from the workforce? And if somebody wants to peg him too, and not just me, that'd be great. So Angela, Elizabeth, Kimberly, what do you guys think? Best ways to collect readiness information from the workforce?
Yeah, I'll jump in to say I loved Kim's suggestion of partnering with your research partners to figure out if they have strategies for collecting the information from the workforce. They could do interviews, they can help with surveys, that sort of thing. But I also think, listening sessions with folks to see what they think too. What do they think is needed for the community? What do they think is a good fit for EBP? Even just in these sort of initial conversations, involving them and holding spaces where they can come and participate is really important.
Elizabeth,
go
go ahead, Kim.
Oh, I was just going to say, I completely agree with everything Angela said. And so you could even host town halls, for instance, and invite members of the workforce within the organization, and also invite community members as well, and having those listening sessions, because it's best to just hear directly from people. And sometimes if you may notice that you've administered a survey and you aren't really getting responses, sometimes just hosting times where people can come in and just talk is really helpful. So I definitely agree with that.
Elizabeth, do you have anything to add?
Yeah, we also did some very informal gathering. We went and talked to the people that we have the best relationships with, that also had good relationships with their peers, that would come to us and say, hey, so-and-so is really concerned about this, or would come to us anonymously and say, here's our concern with this. So one of our biggest concerns was we already had an ACT team, but they were not called that. They were a different name. And they were concerned that they were going to lose their current caseloads and get only a very difficult caseload. And so we had to plan it so that their caseloads would be a mix of the medium hard and the hard clients, so that they wouldn't be shifted over, so that they were only seeing the hardest client. And we only got that feedback because one of the people that is notoriously vocal came to us and said, here is the issue that we have. We don't want to have only the 5 most difficult clients on our caseload. That is draining to us. So we adjusted and made that work within the Fidelity model.
Yeah, that's great. Now I'm gonna wrap us up real quick. I'm gonna make the connection of this example with the workforce over to leadership identifying the research partner. So I have an example of an outreach from one of the CCBHCs wondering if Innovations would be a research partner in this work. And although super interested, at the end of the day, as I was questioning the leadership, they have a longstanding relationship with a couple researchers that staff knew. And so my suggestion in all of this, it's not just readiness to implement the EBP, but if you're going to bring somebody into your organization that's going to live with you for a few years, to do this, much like Angela and Marlene talked about in the last meeting, if they're going to be in your space, if they're gathering the data and the staff are not doing it, right? You might have a process where you gather the data and then ship it off. But if they're going to be in your space, your people that have to interact with that researcher need to actually feel as good about that relationship as they do the EBP that you're going to implement as well, right? Like you don't want to be upsetting the apple cart with staff that you need to implement. So on that note, next month is about implementing quality improvement center, CQI processes, fidelity and quality measurement models. And I'm very excited to host that again. So we look forward to having you next month as well. And Gary just dropped the evaluation in the chat. Please take time to do it. We would love to have your feedback. We've saved a couple sessions at the very end to be about things you tell us that you still need to hear from us, or information that would be helpful as you're going through this process with researchers developing this implementation science project. So please, please, please take care. Do the evaluation. We need it. Speaking about doing implementation science research, please do the evaluation. thank you all for coming. We'll see you in a month. And please reach out. I know the folks from National Council, us at Innovations, anybody would be very happy to hear from you and jump in, roll our sleeves up and see if we can be of help to you. Okay, thank you.
Thank you all.
Thank you for joining this month's Learning Community session. Please take a few moments to complete the evaluation for this session using the following link being posted in the chat. We hope you join us again for next month's Learning Community session.